So, topicals. How do you start with some of the topicals in your patients?
Well, I like to ask how the patient is using them, if they have tried them before. And I will make sure if they're using, let's say, a clinical strength deodorant in the armpit area, they should put that on twice a day, which is often not what they understand, or they don't read the label, or they just forget to do it. But they'll get a much better outcome if they're able to do that. If they're using a product like aluminum chloride, they really have to put that on dry skin so as not to make the skin get irritated from the weak hydrochloric acid that is formed. That will irritate the skin if that medication is applied to a moist surface. So educating the patient to use it properly. Topicals can be very effective. We're actually really excited that I think we're going to have more therapies in the topical realm that will expand our ability to help so many patients and not use a systemic medicine, which some patients are a little bit loath to do.
And I think, so many patients are told to occlude their aluminum chloride. Is that something that you suggest or don't suggest?
I generally don't suggest it, although that was the way I was initially taught. I think I've learned that increases the irritation. Right. And if applied to dry skin, many patients can do quite well with that. Many of the patients I have, and I know the same is true for the ones that you see, are so severe in their hyperhidrosis, they really need additional therapy. But when that can work early on, it can be a really wonderful means for the patient to control a troublesome condition.
Right. And do you find that your patients are coming in having tried some products from the internet or, some different aluminum chloride products or other things that they've gotten from?
Well, absolutely. I mean, this is the era of do it yourself, and of course it should be natural as well. But, I think first and foremost, which was mentioned, it's how you use it. I think there's also a big misperception. A lot of people think deodorants and antiperspirants are the same thing. So I have a patient putting on a deodorant 3 times a day, which is not going to do anything for sweating, and they're going to create an irritant dermatitis because it's going to be some antimicrobial or some fragrance material, has nothing to do with blocking sweat. And I think that's really what I talk about is what an antiperspirant does. Its purpose is to occlude the openings, form kind of a plug with elements of the sweat. I really lean more towards the aluminum zirconium formulations because there's a decreased risk for irritation from that hydrochloric acid. And I tell you, when I tell them that, oh yeah, if you put on aluminum chloride formulation, when you're sweating, you'll form some hydrochloric acid, their eyes bulge. They're like, wait, what? What am I putting on my skin? So that really gets them on board when using it the right time, which is at night if they're gonna use an aluminum chloride solution. And I think using a deodorant in the morning or a deodorant antiperspirant in the morning, but you gotta do the antiperspirant at night because that's when you're not sweating. That's when you have the greatest chance to occlude those pores to prevent that sweating.
And I know for me, I'll have patients, maybe use the aluminum chloride prescription strength maybe 3 nights a week, and then the other nights using an over-the-counter clinical strength, and then using the clinical strength in the morning as well. So it's not an all or none phenomena, really trying to find that regimen that works best for them and their skin type. We've sort of focused on the axilla, but these products can be applied to non-axillary sites, right? Hands, feet, as you mentioned, under the breast, any of the areas that are affected with hyperhidrosis.